Welcome to the MPH program here at St. Ambrose University and to the MPH516 course. This is the introductory course of our program. It's a one-credit course to get you started in thinking about your final internship, known as the Applied Practicum Experience, which you can start working on early but will register for at the very end of your master's program. The second topic of discussion is the Integrative Learning Experience, which will be a final written output. Because you'll determine the types of projects yourself, it's important for you to think early on what's expected and to start identifying potential final projects while you're taking courses throughout your program. The MPH here at St. Ambrose University allows you to focus on your passions related to public health, and as such, there is some flexibility as your passions and interests may change. So just remember as you go through this course that your ideas and thoughts here are a starting point, and that if you change your mind as you go or you find and develop new passions, your APE and ILE may also evolve. However, one of the first things we will ask you all to do as part of this course is to complete and obtain a University of Indiana plagiarism certificate, and this is important for your success in the program. In addition, you will be exploring options for your applied practicum experience, and we'll actually draft a brief plan in weeks 3 through 5 for your APE, and then in weeks 6 through 8, you'll explore options for your integrative learning experience and draft a plan that will be due at the end of this term. It's very important that you take this detailed course that explains what plagiarism is and what it isn't. Knowing what it is will help you to avoid plagiarism. Please complete this course and email your advisor, your instructor, your certificate by the end of week 2. The plagiarism course requires intense focus, and completing it is essential to the success of the program, particularly when you write assignments, but also to ensure everyone has the same knowledge regarding APA referencing style and also the ability to paraphrase and reference the literature and discussion board posts. In this course, you'll begin to prepare for your Applied Practicum Experience, otherwise known as your APE. The APE itself requires 200 hours of practical experience collaborating with a community organization. And in this APE, you will each demonstrate at least 5 competencies. And 3 of these must be selected from the 22 foundational competencies that I'll describe further on in the slides. The remaining 2 can be selected from the generalist or foundational competencies, depending on the level of your interest. So the first point will be for you to know and understand the competencies and link those to your passions to make a plan. In addition to the APE or Applied Practicum Experience, you have something we'll call the Integrated Learning Experience, and this is going to be a written output that you select. This also emphasizes a set of generalist or foundational competencies based on your own interests, and you need to plan for your ILE by selecting, together with your faculty advisor, the competencies that are most appropriate to your educational and professional goals. You will be preparing for your ILE, which will be a class entitled MPH 700. This will be your final class of the MPH program, and you prepare this throughout your curriculum. The outcome will be a high-quality written product, and the format that takes will depend on your interests. So again, it's important that you know your competencies, know your passions, and use those to make a plan. Before delving into the competencies, I want to talk about the 12 core learning objectives, and these are foundational knowledge that all students in public health should know before finishing their master's in public health. One of the broad categories of the learning objectives relates to the profession and science of public health. So first, you'll be expected to be able to explain public health history, philosophy, and values. And secondly, to identify the core functions of public health and 10 essential services. Third, you'll be expected to explain the role of quantitative and qualitative methods and sciences in describing and assisting a population's health. Fourth, you should be able to list the major causes and trends of morbidity and mortality, not just in the U.S., but also in the global community. Fifth, You'll be asked to discuss the science of primary, secondary, tertiary prevention and population health, including health promotion, screening, etc. And 6, you will be asked to explain the critical importance of evidence in advancing public health knowledge. The second split in the core learning objectives has to do with factors related to human health. So the 7th core learning objective relates to explaining the effects of environmental factors on population's health. 8 is to explain biological and genetic factors that affect a population's health. 9 is to explain behavioral and psychological factors that affect a population's health. 10 is to explain social, political, and economic determinants of health and how they contribute to population health and health inequalities. 11 is to explain how globalization affects global burdens of disease. And finally, 12 is to explain an ecological perspective on the connections among human health, animal health, and ecosystem health. Next, I come to the public health foundational competencies, and these are competencies that are in common with all other MPH programs. And these are split into a set of different categories, whether those are evidence-based, healthcare systems, planning and management, policy, leadership, communication, interprofessional practice, or systems thinking. So as you select your foundational competencies of interest, think in terms of these broad categories first. That may help you narrow it down to 3, 4, or 5 competencies. Now you can select up to 5 competencies from this list, but you must select 3 for both your APE and your ILE course. I'm going to go through each of the competencies by subheading. And the first subheading is evidence-based approaches to public health. There are 4 competencies under this heading. The first is to apply epidemiological methods to the breadth of settings and situations in public health. Competency number 2 is to select quantitative and qualitative methods appropriate for a given public health context. And 3 is to analyze quantitative and qualitative data using biostatistics, informatics, computer-based programming, and software as appropriate. So competency number 2 and 3 both include both quantitative as well as qualitative methods. Competency number 4 is to interpret results of data analysis for public health research, policy, or practice. The next major subheading after evidence-based approaches to public health is public health and healthcare systems. So this is a systems focus in public health. Competency number 5 is to compare the organization, structure, and function of healthcare, public health, and regulatory systems across national and international settings. So just remember here, competency number 5, the focus is on a comparative perspective. Competency number 6 is to discuss the means by which structural bias, social inequalities, and racism undermine health and create challenges to achieving health equity at organizational, community, and societal levels. So we're talking about healthcare systems, but we're talking about them in relation to health inequality. The next major heading under the foundational competencies relates to planning and management to promote health. And there are 5 competencies here. These are competencies 7 through 11. And competency number 7 is to assess population needs, assets, and capacities that affect communities' health. 8 is to apply awareness of cultural values and practices to the design or implementation of public health policies or programs. 9 is to design a population-based policy, program, project, or intervention. 10 is to explain basic principles and tools of budget and resource management. So here, think in terms of health economics. And number 11 is to select methods to evaluate public health programs. The next major category under foundational competencies relates to policy and public health. There are 4 competencies under this heading, starting with number 12, which is to discuss multiple dimensions of the policy-making process, including the roles of ethics and evidence. Competency number 13 is to propose strategies to identify stakeholders and build coalitions and partnerships for influencing public health outcomes. 14 is to advocate for political, social, or economic policies and programs that will improve health in diverse populations. And 15 is to evaluate policies for their impact on public health and health equity. The next major category after policy and public health is leadership. So if you're interested in developing your skills in leadership, you may be interested in one or both of these competencies. So these are competency number 16, to apply principles of leadership, governance, and management, which include creating a vision, empowering others, fostering collaboration, and guiding decision-making. Number 17 is to apply negotiation and mediation skills to address organizational or community challenges. The next subcategory after leadership is communication. And here we have 3 competencies, starting with competency number 18, which is to select communication strategies for different audiences and sectors. Number 19 is to communicate audience-appropriate public health content, both in writing and through oral presentation. And number 20 is to describe the importance of cultural competence in communicating public health content. Finally, we have 2 major subheadings left, each one reflecting a different competency. The first being interprofessional practice, that is competency number 21, to perform effectively on interprofessional teams. And systems thinking, competency number 22, which is to apply systems thinking tools to a public health issue. In addition to the 22 foundational competencies, which you'll have covered throughout your courses, we also will cover the 5 generalist competencies that are emphasized here at St. Ambrose University and reflect our mission and our expertise. These 5 generalist competencies may also serve as part of your competencies for your APE and ILE choices. Now remember, you have to choose 3 of your competencies from the list of 22 foundational competencies, but you can choose up to 2 of the competencies for your APE and or for your ILE from this list of generalist competencies, and these are unique to St. Ambrose University. So the first competency on this list reflects our global focus, and that is to develop public health person-centered business or project plan with strategies responsive to the diverse cultural values and traditions of all communities being served. So global doesn't necessarily have to be research in a foreign country or an international environment, but it can also be a topic of global relevance. Competency number 2 and 3 both relate to social justice, which is a strong focus of St. Ambrose University. So competency 2 is to apply ethical principles and decision-making in regard to social justice issues related to healthcare access. Number 3, also social justice focused, is to critically evaluate the social determinants of health and understand how they contribute to health inequalities. Competency number 4 is evidence-based. That is to apply both systematic literature review methods, and that can be meta-analysis or PRISMA approaches, to synthesize the literature and to identify evidence-based recommendations for researchers, policymakers, and practitioners. And this is a competency that will be covered in depth in your evidence-based practice course. Competency number 5, also evidence-based, is to apply a social, ecological, and person-centered framework to identify, implement, and evaluate evidence-based interventions that promote population and community health. It is important that you know that each of the competencies and also the core learning objectives are all linked to courses. So we have different levels of introducing, reinforcing, and emphasizing each of the competencies and core learning objectives so that they're covered well throughout the courses that you take. So therefore, we have in every course syllabus a heading linkages to MPH foundational competencies. And so you'll see a statement in your syllabus for this course. This course introduces the Council on Education for Public Health, in parentheses CEF, foundational competency number 5, which is to compare the organization, structure, and function of healthcare, public health, and regulatory systems across national and international settings. Because we're introducing you to public health and also public health in the international setting. You'll find examples from public health practitioners globally, and you'll be asked to comment on what that means in terms of public health and what that means in terms of your own interests. In addition to covering foundational competency number 5, this course also introduces up to 5 additional C foundational and also the St. Ambrose Generalist competencies based on student self-selected choices. In other words, you're choosing yourself which ones you're focusing on for the purpose of your APE and ILE planning. In addition, we'll introduce the C core learning objective number 1, which is to explain public health history, philosophy, and values. So just remember that we do cover all of the competencies and learning objectives within the courses, and then at the end of the courses, when you do your APE and ILE, you'll delve into the foundational competencies and or the St. Ambrose Generalist competencies based on your own choices. In making your choices about the competencies that you'll focus on for your APE and ILE, it is very important that you begin to communicate with your advisor very early. So reach out to your advisor, your instructor this week, to schedule a meeting and begin the discussion around your ideas about your vision of life after your MPH. And that's very important because what you want to do after you finish your MPH will determine the most important aspects for your APE and your ILE. These are where you develop the skills and competencies that you're going to rely on later after you finish the MPH program. It's also very important that you ask any questions you have and that you become comfortable with asking questions throughout this course, because asking questions will be really critical to your success in the program. Finally, I just want to end on the note that communication is very important. We look forward to hearing from you. Please don't hesitate to ask questions, to send emails, and to communicate with us any issues or concerns that you have. Thank you very much.